Welcome back to our video series, It Falls on Me, where we look at ways we can all prevent falls from happening. Today, we are going to take a closer look at bed alarms. When we look back at our data for our patients that have had a fall with major injury, we can see that the majority of them did not have an alarm in place when they should have. This video will review how to make sure alarms are set, troubleshooting techniques, and addressing some barriers for making sure that the bed alarms are on. Remember, all new admissions at Cardinal Hill are considered a high fall risk. Patients that are considered high fall risk must be set on bed alarm fall level, formerly called Zone 2. For both Stryker and Hill-Rom beds, you must remember to change it to the fall level zone. When the alarm is initially activated, it defaults to the basic level, formerly called Zone 1, which is a lower sensitivity. Here's a closer look at how Hill-Rom beds are set. To enable the alarm, press the key button, then press the desired patient sensitivity. For our high fall risk patients, this is the middle button. The system will beep once, and the bed exit button will stay illuminated. Most beds on the inpatient rehab units are Stryker beds. To enable the bed alarm, press the Arm-Disarm button. The bed exit light will illuminate and defaults to the basic level, formerly called Zone 1. Press the Zone button to increase sensitivity to the fall level, formerly called Zone 2. If the hospital bed is not connected to the wall connector, the alarm will not alert to the call light system. To ensure the bed alarms can be responded to promptly, make sure the bed is connected to the wall prior to leaving a patient's room. Never unplug the part at the outlet on the wall. If you must move or exchange a bed, make sure you only unplug at the breakaway point. From the survey that was sent out to staff, the top 3 barriers that were listed were that the alarms were too sensitive, they forgot to set it, and patients refused them or turned them off. Let's first discuss troubleshooting sensitivity. If the alarm is sounding when you change the position of the bed, you should turn the alarm completely off, change the bed position, and then turn the alarm back on to the correct sensitivity level. Because the alarm is reacting to changes in weight distribution, if you change the position of the bed, it could cause the alarm to sound. So, if a patient requests to have their head elevated or lowered, simply reset the alarm by turning it off, adjusting, and then turning it back on. If the alarm is sounding without a bed changing position, it needs to be re-zeroed. The bed is likely operating by thinking a patient of a different weight is there, or there has been a change in weight. If a patient has added or taken away linens, this can cause the alarm to sound when it is not warranted. To save time and effort, it is best practice to zero the bed every time before you assist a patient back to bed. To zero the bed, before the patient gets in, press and hold the 0 button. It will then ask you to wait, and then the screen will say, "Zeroing successful." You can then proceed with helping the patient into bed. Another barrier that was identified during the survey was that staff would forget to set alarms. There are now reminder magnets in all rooms that will be visible as you exit. It is best practice to do a safety check at shift report and during purposeful rounding. For therapy, always check alarms at the end of your session and document. Even if therapy took place in the bed or the patient has back-to-back therapy sessions, ensure that alarms are on before you leave every patient. For the Stryker beds, the green light at the foot of the bed does not mean that the alarm is on. To check the alarms, lift the panel at the foot of the bed and make sure that bed exit and the appropriate zone are illuminated. Our final barrier that was brought up is what to do if a patient refuses. As with any medical intervention, the patient does have a right to refuse. The first step is to educate. Kindly explain that because of their new diagnosis, medications, and hospital stay, they are at a high risk of falls. The alarms can help staff assist in preventing a potential fall from happening. Always document the education you provided in ACIT and the patient's response to the education. If a patient continues to refuse, escalate the issue to the charge nurse, nurse supervisor, or therapy lead who can provide additional education to the patient. After all steps have been followed, one final step, if the patient continues to refuse, is to have them sign the Against Medical Advice form. Follow the escalation protocol found on Hospital Policy on Demand. Remember, it falls on us to keep our patients safe.